Alrighty, now our session is being recorded. This will be available to you sometime probably later on today or tomorrow. And this is day 8 of our 30-day challenge, how to make your medical exercise training practice referral ready in 30 days. Now, folks, let me make sure you understand. Just because you got your certification and you open your business, your studio, you're going to clients' homes, doesn't mean you're going to automatically get referrals. Now, you may get a referral, but the question becomes, can you manage that referral? So that means there's a communication, a two-way communication streak between you and the medical provider. There also has to be communication with the client. And if for some reason there is a third party involved in paying the bill, you have to also be able to communicate with them. So we're going to go over all the components necessary over the next, we got 22 days left with regard to how you can build your medical exercise training practice to be referral ready. Now, I just put a link in the chat, and that link in the chat actually will allow you to download the forms we're going to talk about today. Today, we're going to talk about the MET new client intake and consent forms. Now, when you go into the hospital or you go to a medical clinic, you're essentially signing a consent form, a consent for services. So we wanted to make sure that we were trying to align what you do as a medical exercise professional with, to some degree, what we see in the healthcare system. So we're going to talk about client intake forms and consent forms. Now, these become important because when a referral is sent to you from a doctor, therapist, or chiropractor, they're expecting you to conduct yourselves the same way that they conduct themselves. So remember this, you're playing in their sandbox. Now, we live right across the street from a school. And, if you're the new kid at the school and you're trying to go on the playground or play in the sandbox, you got to kind of play the way the kids at that school play. You may play a different way at your school, but now you're at the new school and you want to play in their sandbox. So please, if you would, you're going to have to align many of the things that you're doing, not as a healthcare professional, because you're not providing healthcare services or treatment, but you may have to play in their sandbox and you have to align some of the administrative things that you do in the same manner that the medical community does. That's why we're talking about this idea of MET new client intake and consent forms. So with that, please remember, we've got a couple of manuals that are available. Some of you have these already. We have a Cracking the Code manual. We put this together maybe 2 or 3 months ago. It's for medical exercise professionals that want to deal with insurance carriers. We have had some significant success with medical exercise professionals receiving insurance reimbursement. It's called Cracking the Code, the ultimate guide to insurance reimbursement for medical exercise specialists. Also, our second manual is our Advanced Medical Exercise Specialist manual. Hopefully you can see that. That manual is mammoth. It is 1,228 pages. It's everything we've learned about managing a medical exercise training practice over the last 31 years. We put those two together. It is a digital download where you'll get both manuals for $199. They actually go for $249, I think, and $129 separately. So you may want to take advantage of that. Go over to crackingthecode.net if you want to get both of those. They may be helpful for you. And with that, we're going to talk about the MET new client intake and consent forms. So if you don't mind, please make sure you go over and get your forms. I'm going to put this in the chat one more time. And my computer's acting a little weird here. I'm going to put this in the chat one more time. Please make sure you follow the link I've just put in the chat. Follow that link, and you should be able to put in your email address, phone number, and your name. You should be able to download the forms we're talking about. The forms kit is a PDF document, and there are, I believe, 6 pages with it. There are 3 forms there, and we're going to talk about those forms here. All right. So now I need to do this, and I know some of you get tired of this, but I have to reinforce this. Your scope of practice as a medical exercise professional, whether you're medical fitness, post-rehab, corrective exercise, is the following. Your scope and role is to provide medical exercise training assessments, cardiovascular training, flexibility training, strength training, functional conditioning, balance training, lifestyle education. Put an asterisk beside that. That is going to become bigger and bigger over the next 20 years, and you will be able to get paid from insurance carriers for that. We talk about that in the Cracking the Code manual and also in our MES revenue services system. You also can provide aquatic training and stabilization training. Now, I know we've got a couple people on the call that are licensed massage therapists. They can do soft tissue mobilization. If you're licensed by the state to do it, great. We may have a couple of physical therapists, PT assistants on the call, or occupational therapy assistants, or chiropractors. You're licensed by the state to provide those services, great. But if you are a medical exercise professional, you're certified as a medical exercise specialist, medical fitness assistant, medical fitness assessment specialist, excuse me, anything along those lines, you're governed by these guidelines because there are no state guidelines for you at this point. So you have to make sure that you stay away from infringing on the Practice Act of the physical therapist, the occupational therapist, chiropractor, and also the massage therapist. So with that, we're going to talk about the informed consent form first. If you would, take a look at that handout that we gave you. First page, we talk about the 3 essential forms or essential documents we're giving you. We have an MET informed consent form to ensure the client has an understanding and alignment of what you're providing. Number 2, we will have a physician's clearance form to simplify the referral communication process so that the doctor, therapist, or chiropractor knows what you're doing, who you are, as well as the client. And then thirdly, we're going to talk about a comprehensive medical history form to guide safe and effective exercise program. So if you would turn over to page number 2 in that handout, we're going to talk about this informed consent form. So now this is interesting because the client has to understand the services they're providing. And folks, this is a great form because we want to make sure the client isn't misunderstanding that they're going on through physical therapy. Now, folks, I've been a physical therapist now. This is my 40th year. I actually graduated from Howard University back in 1985. I had hair way back then. And when I graduated, I did one of my rotations in the university hospital. And I wore a white lab coat, a little short lab coat. And it wasn't unusual for patients to mistake me for a doctor and say, oh, you're my doctor. I'm like, no, Mrs. Smith, I'm your physical therapist. So please, if you would understand, when a client comes in your facility, they're seeing the same exercise equipment they saw in the PT clinic. They're doing the same exercises or something similar. So you have to make sure they clearly understand they're there for medical exercise training. So if you take a look at this form, client puts their name, date of birth, phone number, address. You can fill those in. Then the client is going to read through the form. And this is a 2-page form. And you'll notice there on page 2, it says the purpose of medical exercise training. So we're going to go through the purpose of it. Medical exercise training is a structured exercise program designed for individuals with medical conditions who are recovering from injury, surgery, or an illness. MET is intended to improve function, strength, mobility, and overall physical capacity following discharge from licensed physical therapy and occupational therapy services. MET is not a replacement for physical therapy or medical care and does not involve diagnosis, treatment, or manual therapy. Now, the reason we put that in is because we want to make sure they clearly understand. Some clients won't. And let me also say this. Some of you may get a local physical therapist or occupational therapist or chiropractor that gets a bug in their suit because they hear you're providing these post-rehab services. And they're just pissed off about it because they feel everything in the world that's exercise related to a client with a medical condition is their domain. Wrong answer. After the client has been discharged, it's over. So please make sure you stick to your scope of practice and make sure you get the client to sign this informed consent. Let's continue on. The nature of the program. The MET program is supervised by a certified medical exercise specialist trained to implement condition-specific exercise protocols. If you're one of our MESs, that's exactly what we trained you for. Our exercises are based on current physical abilities and adapted to individual medical needs. Now, that's why you have to do an assessment first and determine the client's functional deficits. The program may include cardiovascular training, resistance training, flexibility, balance, and functional mobility exercises. The risk and benefits. Notice we talk about the potential risk first. As with any physical activity, there's a risk of minor injury, strains or sprains, soreness, and in rare cases, cardiovascular events. It is important that you report any unusual symptoms, dizziness, shortness of breath, pain immediately. The benefits: improve strength, endurance, balance, mobility, function, reduction in pain, physical limitations associated with chronic medical conditions, and enhance ability to perform daily activities and maintain independence. Client responsibilities. Notice the client has responsibilities. Please, folks, understand you're not just providing the service. You're providing the service. This is a give and take situation, as well as with you and the medical provider. It's a give and take. Notice I said earlier, it's a two-way street with communication. The client's responsibilities include: I agree to follow the instructions provided by the medical exercise specialist. I'll report any pain, discomfort, unusual symptoms, or changes in health status. And I understand that participation is voluntary and it may stop at any time. Also, it also gives you information on medical clearance and acknowledgement. They acknowledge they've been referred by a medical provider and received medical clearance to participate. We'll talk about that in a second. They understand also medical exercise training is not a substitute for physical therapy or medical treatment. And they affirm that the information they've been provided with my medical history, they're going to do a medical history interview, you're going to do that with them, is accurate and knowledgeable. They sign it, date it. That's the informed consent. You keep this in your files. Okay. So this way, everybody understands exactly what's going on. Please, if you would, make a note. Some of your clients may suffer from dementia, early stages of Alzheimer's disease. In that situation, maybe you have a friend or a family member that may also be with them and they sign the document for you. So if you would, that's our informed consent form. Now, next one is our physician's clearance form. Okay, physician's clearance form. And that is actually, we got this a little mixed up. If you would, turn to the last page of the document, page number 6. My apologies. Okay, this is a physician's clearance form for medical exercise training. Okay, this is on page number 6. Please, if you would, we note the client's name, date of birth, phone number, address. You can fill all of that out and make sure with the addresses on any of these forms, you include street address along with city, state, or province, city, and zip or postal code. To the referring physician, your patient is interested. Now, you listed the patient at the top of the document. Your patient is interested in participating in supervised medical exercise training program. NA, excuse me. The program is designed for individuals with chronic conditions or post-rehabilitation needs who are no longer eligible for skilled physical therapy but require structured medical informed exercise to maintain or improve function. Please review the patient's medical history and indicate whether there are any restrictions or contraindications in participating in such a program. Now, folks, you're sending this document to the doctor, therapist, or chiropractor. Preferably, you're sending this to the physician. We really need the physician to sign this. You will run into some clients, they don't have a physician of record. All kinds of things are going on. Their insurance carriers dropped them, whatever the case is. You want to get this signed by the physician, but the next best choice would be their physical therapist. So at least someone says, okay, we looked at their history, they're eligible. Please, if you would, I would say in 99.9% of the cases, get the physician to sign off on this. Please review the patient's medical history, indicate whether there are any restrictions or contraindications to participating in the program. You're asking the physician now to note the diagnoses, any relevant surgery or medical history. Are there any contraindications or precautions for this patient? Recommend restrictions or considerations. The physician signs it, phone number, fax, signs it. I'm sorry, they print their name, excuse me. Phone, fax, sign, date. Now, in this document, you're asking about the patient because it's the physician's patient. We're going to always refer to the individual we're providing medical exercise training services to as the client. So please, if you would, make a note. This is a client, not a patient to you. It's a patient to the medical provider. You also are providing exercise, not therapy. And also with that, you're not in any form providing any type of services as a therapist. I know some of you have certifications as exercise therapists. I'm going to step out on a limb here, and I'm going to say those to some degree, in my opinion, are inappropriate. And we have had some of our MESs that have had to deal with medical boards, physical therapy boards, because they utilize the term therapist in their titles. We had a situation in New York several years ago where one of our best MESs took a certification from an organization. They told her she could use the term therapist in their in her marketing, and eventually the board filed suit against her, and $6,000 later she was told simply to remove the title by the attorney general of the state that she resided in. So let's be careful about that. All right, let's move on to our next form, and our next form is a comprehensive medical history questionnaire. Now, let me stop for a second. I think somebody just joined us, and if you're just joining us, I'm going to send a link here. Someone just was asking about that. I'm going to send the link again with the forms in it. All right, so I think someone just joined us. Alex, I see you're asking for the forms also. My apologies. If you are just joining us, please scroll back through the chat. And if not, I'm going to put this link in again. And you're going to be asked to, when you click the link, it's going to ask you for your name, email address, and a phone number. Please, if you would put that in, and you should get the forms, able to download those, or you should get an email that allows you to download those. Okay. We put these forms together. They were produced by the Medical Exercise Training Institute. Please feel free to use them for your own personal utilization. All right. And with that, let's talk about this comprehensive medical history form. And let me make sure I'm on the right slide here. Yep. We're talking about our comprehensive medical history form. So with that, folks, on page number 4, you have the comprehensive medical or health history form, excuse me. Okay. Again, you're going to include the client's name, date of birth, phone number, email address, emergency contact, primary care physician or provider, and the phone number. Okay. Now, the reason I say primary uh, care provider instead of physician, it could be a nurse practitioner, a physician's assistant, whatever the case is. Make sure you note that individual. Now, let's make sure you understand you're going to conduct a medical history interview. Now, folks, I've been a medical professional for now 40 years. I've taught in multiple medical schools where I've taught in the orthopedic surgery program. So we're actually teaching licensed physicians how to go about examining patients as well as managing patients. Also, I worked in physical therapy, educational programs where I've taught physical therapists, athletic trainers, and others. One of the key things is you want to do a comprehensive health history questionnaire/interview. Please write that down. This is an interview. A lot of times we have clients, they fill out the form and we kind of glance at it, we stick it in the chart, and then we start with treatment in the medical community or exercise in the fitness industry. Please, if you would, go through each one of these items and ask the client. Here's what you're looking for. Now, folks, I am 63 years old. I'll be 64 in November. I was young and dumb when I was in my 19 years old, and I went to Army paratrooper school. I was a paratrooper and a ranger for 7 years. Well, during those crazy years, jumping out of planes, I dislocated a hip and had to have pins put in my hip. Probably if you met me, you would never notice it unless I'm standing up for a long period of time. And here's what's going to happen when I come to you as a client seeking medical exercise training service. You're going to ask me, well, Mr. Jones, have you ever had any surgery? No. No means yes, I have. No means I don't want to tell you I had surgery because it's a minor issue and I don't want it to prohibit me from exercising. So the reason you're going to go down this list of items here and ask specifically is you want to get an affirmative answer. Yes or no. The no says, let me ask more. So with that, it's interesting. And I've had patients over the years that were referred for a particular condition. And then we found out on the interview, whether it was in our physical therapy clinic or in our personal training and medical exercise training program, that yes, there were past injuries or issues that we did need to understand to make sure the program was safe and effective. So you're going to go through the medical history here. Ask them, do you have a history of arthritis? If they say yes, where? Osteoporosis, diabetes, heart disease, hypertension, stroke, COPD, asthma, cancer, any types of cancer, obesity, depression, anxiety, neurologic disorder, and others. Are there any other things that you can tell me that we just need to know about in developing the exercise program? And what we're looking for is any hesitation. Well, no, not really. Well, tell me, what else do you have? Well, you know what? Years ago, I had gout. Probably not a big issue, but it's something we need to know about. Also, you ask about surgeries and hospitalizations. Folks, as I said, I was hospitalized. God, that was back in 1980. Okay. I spent a few days in the hospital at Fort Bragg, North Carolina. They put the pins in. I was on recuperative duty for like 2 months, and then I was back to my unit as a lieutenant jumping out of planes. Never missed a beat, but is that something that you should know in the exercise program? Yes. So ask about surgeries and hospitalization at the bottom of page 4. Top of page 5, ask about medications. Now, this is where all of you should have a physician's desk reference so that if the client is taking medications, you can look those medications up to see if they will have an impact on exercise. Also, next section, note any functional limitations. Do you currently experience any of the following? Difficulty walking, balance issues, pain with movement, shortness of breath with activity, joint stiffness, muscle weakness. Now, notice all the questions are specifically pointed toward medical conditions. I know as fitness professionals, you do understand how to do the PAR-Q and you understand how to get some background information on the client, but this particularly is looking at focused on medical conditions. Exercise history. Do you currently exercise? If yes, what type, how often? Have you ever worked with a personal trainer, physical therapist, or exercise specialist? Yes or no? Describe it. And then goals. What are your primary goals for participating in the medical exercise program? You need to know what their goals are. And also, do you have any concerns? Client signs it, dates it, and along with that, you should note this, and all of these documents are going to go in the client's chart. Now, you can keep them as digital documents, but you want to make sure that you protect these documents utilizing HIPAA guidelines because you're protecting the client's privacy. You don't want their information all over the gym with everybody there. And if you're using paper copies of this, make sure you just don't leave them laying around on a piece of equipment. Make sure that you put these documents, if they're hard copies, under lock and key where they can be protected, because insurance fraud and personality fraud and personality identity theft, excuse me, is very rampant out there, especially in our seniors. So be careful about that. So with that said, these are the MET new client intake forms. So we got 3. Again, we have, and these are in the document there. You're able to download these. So the first one we talked about was our medical exercise training informed consent form. The second one we talked about was the medical clearance form from the physician. And then we also talked about a comprehensive health history form. Now, all of these are important because this information allows you to have a better understanding of where the client is. It allows you to communicate with the doctor, therapist, and chiropractor so everyone is on the same accord. This becomes vitally important. We're all on the same accord. Now, please remember, you're an extension of the physical therapist, of the chiropractor, of the physician. You're tasked with providing the exercise. And let me conclude with this. There's a new concept in healthcare. When I say new, relatively new, it's been around for maybe a decade or two. And this concept is that of value-based service. Value-based service means we're not just doing fee for service, which meant you just simply provided a service and the insurance carrier the client was supposed to pay. Value-based service means, is your service valuable in managing the client's condition, preventing further deterioration or further loss of function, maintaining it, or improving the level of function? So as we move forward over the next 20 years, medical exercise training becomes more and more important because with our rush of seniors, and I'm in that group at 63, with that rush of seniors, we're going to find half the battle is after therapy is over, half the battle is maintaining, the other half of the battle is possibly improving, and this becomes vitally important. That's why we do need the informed consent. That's why we do need the referral from the physician, and that's why we also need to conduct a comprehensive medical history interview. All right. So with that, anybody have a question, thought, idea? We try not to keep you here more than 25 to 30 minutes, and I've got 24 minutes. Anybody have a question? Anything?
Great question.
All right, now make sure you download those forms. We're going to be back tomorrow with day number 9. I have to be honest with you. I don't know what we're supposed to talk about on day number 9. They just put me in here and I teach the classes, but we will see you tomorrow. Please go over to crackingthecode.net later on this afternoon. The recording for this will be up, and please make sure you use that link and download those forms. Now, let me close with this. Medical exercise training is not just simply, hey, I got a client with a medical condition, I got certified, I'm going to provide some exercise. It's not that, folks. I'm the guy that started it 31 years ago. We started it because we had a situation with a patient that was mangled by a trainer. Myself and the orthopedic surgeon were livid. We talked to that trainer on speakerphone. We didn't have cell phones then. It was not a nice conversation. But later that evening, I was teaching my nephew D's, whereas he was a little kid. He was used to B's. And it dawned on me, the trainers didn't know. Now, with that, that's why we started the medical exercise specialist. And over the last 31 years, we've seen a shift now where more and more medical professionals are referring clients, and that number is going to get even greater over the next 20 years. So please, if you would, be ready, and your practice is ready for referrals. It's not just simply I get a client, I start working with them, I start charging them at a higher rate. It's I have to communicate with the doctor, therapist, or chiropractor. So please, if you would, think about this. If you have a client with a medical condition and the doctor, therapist, or chiropractor referred them, or the client showed up on their own, or there was another referral source, and they have a medical condition, is it incumbent upon you to communicate with that doctor, therapist, or chiropractor? Yes. So from the person who started medical exercise training 31 years ago, if you're not communicating with the doctor, therapist, or chiropractor, please, if you would, say, I'm doing personal training with a client with a medical condition. That is not medical exercise training. Medical exercise training or medical fitness training is where I am communicating with the doctor, therapist, or chiropractor to give them updates on how well the client is doing. Because the bottom line is, if they were referred by a doctor, therapist, or chiropractor, or another healthcare provider, They were referred because they realized there is a medical necessity for exercise in this client's overall medical management plan. Please, if you would, write that phrase down: medical necessity. Getting that referral from the physician, a written referral, now indicates you are medically necessary. There's a medical necessity here, which now means you've got to communicate with the doctor, therapist, or chiropractor. So with that, have a great remainder of the day. Have a great week. Thank you for joining us. I will be here again tomorrow. If you have questions for me later, email me at drmike@postrehab.com.